Betty Tom.
and Reverend Betty Tom,
And also the Dr. Vernon House.
Dr. Vernon House. Is there anyone that I've overlooked? I don't think there is. But anyway, I'm going to turn this back over to Senator George Latimer, the candidate for county exec on the Democratic line. But this is not a political thing. This is merely what Democrats have always stand for, making lives better for all the citizens of the county of Westchester, and even all those who come in from other counties. But back to George Latimer.
Thank you, Ben. Thank you very much. So, the purpose we're here to talk about is healthcare and how important healthcare is for people who are poor and people who are working poor. And as I've often told the story about my mom and dad, my dad was a maintenance man, my mother was a factory worker, so there are so many other mothers and fathers in this neighborhood and beyond this neighborhood that want to do right for their children, the little children we see and the many children we don't see. And part of that is education, part of that is nutrition, but part of that is having health care. And the way this center developed was to serve a need preventively so that we don't use the emergency room of a hospital as your primary care physician. And the concept of a neighborhood health center is not unique to Mount Vernon. As pointed out, we have them in Greenburgh, we have them in Ossining, in Portchester, in Yonkers, we have them in Peekskill. And in every one of those areas, they provide a first line of resource so that a mom can bring her children here and she can get a confidence level that her children are being taken care of. Healthcare is very different today than it was all those years ago when I grew up. The Marcus Welby come to your home scenario is long gone, and the cost of healthcare becomes very difficult. You've seen the national government under Donald Trump do everything he can do to eliminate the affordable healthcare plan that was created by President Obama and the Democrats when they were in charge of the nation. 24 million people may be thrown off of healthcare. So where do you go to ensure that your kids have the proper healthcare? You come to a neighborhood health center like this, where healthcare is accessible, where you can come in and be treated, and even if you don't understand all the difficulties and the complications of healthcare, you can have people that will help you know how to take care of your children and yourself and your family. That's why we're here today, and that's why the problems that we have with government really make it more difficult for people to be able to use a facility like this, and more importantly, to get the help they need. Now, Westchester County has a role in all of this. Westchester County has a Department of Health, and Westchester County has a Department of Mental Health. And those services are supposed to mesh with the state and the federal government to provide on-the-ground help. But Rob Astorino, who's headed the Westchester County government for the last 8 years, might come to Mount Vernon. He might have people saying nice things about him. But what Rob Astorino has done during his 8-year tenure is he has cut by 27% the funding for health care in this county. Department of Health cut by 27%. On the area of mental health, cut by 50%. Now, he'll make the argument that he can run the county government just as well on the same amount of dollars. It's just not true. When you cut those funding, you cut the services, and what you're really doing is you're turning your back on Mount Vernon. You're turning your back on Peekskill. You're saying that you may not need what people in this neighborhood need, and so therefore it's not important to worry about the people in this neighborhood. But that's dead wrong. I'm going to read just a couple of statistics, just so you know the numbers I've referenced. The mental health budget was cut. It was a $17.9 million budget in 2010 when Rob Astorino took office. Now that department is at $8.7 million. That's a $9.2 million cut, over 50% cut in the funding for mental health services. When you look at the concern that we have over gun violence, and there are people who say, well, you know, it's not guns that kill people, it's people that kill people. We need to do something about the mental health of people, right? That's what they say as a response. Well, your response can't be, let's have guns available in the community and let's cut money for mental health. That's exactly the opposite of what you intend. The Astorino administration cut the county's commitment to health care by $41 million. $175 million in 2010, $128 million, a 27% cut in 2017. And it's not just in health care. In daycare slots, there are parents that need help, subsidy in order to have daycare. It's daycare that allows the little ones to be taken care of while the moms can go to work and be a productive member of the society. People will say things about, well, they don't want to work. No, they want to work, but they need someone to watch the children in a proper setting. And they've created a situation over the last 8 years that the contribution of parents toward daycare has gone up from 10% of the cost a month to 27% a month. That's almost 3 times an increase in what the parent has to contribute. The number of low-income slots have gone to 2,700 slots across in 2015, and that's a reduction from what it was previously, and the plan is to reduce it further to 2,400. So when somebody says we're running the government the same as we did before, they're assuming that the listener doesn't need daycare. They're assuming that the listener doesn't need neighborhood health services. They're assuming that the listener doesn't need mental health services. But the county government, the function of county government is to address the needs of all people, not just the people that don't need that help. And that's where this county government has failed Mount Vernon. And I take it personally in this regard. I was born at Mount Vernon Hospital almost 64 years ago. Rob Astorino was born at Mount Vernon Hospital, the same building. I still remember my Mount Vernon years. They're important to me. The people of Mount Vernon matter to me. I don't turn my back on my hometown and forget the need on the very streets that I grew up on. But Rob Astorino, a Mount Vernon native, has forgotten this. And when you talk about these kind of cuts, it's not just numbers. You're hurting real people. You're hurting people that just want the same thing we all want. They want to have a better life for their family, a better life for their kids. Things that regard with health care and these other services. One more point before I introduce my colleague Jamal Bailey and then the other people who are going to speak. The concept of a neighborhood health center is not a partisan concept. Barack Obama supported that concept. George W. Bush was a major supporter of the need for neighborhood health centers. And then his predecessors, his father who was president as a Republican and Bill Clinton as a Democrat. This concept has been bipartisan in both parties until Rob Astorino and Donald Trump. They have determined that there's a different America, that it's not the America where we work together and we find common solutions and that we try to prevent some of the health things that we have. This is an America under Donald Trump and Rob Astorino that says, I got mine, Jack. I hope you can get yours. And that's not the way America should be. So I want to introduce my colleague who is a state senator. He represents the larger portion of Mount Vernon and a significant portion of the Bronx, the Honorable Jamal Bailey. Senator. Thank you, George.
Good afternoon, everybody. And I was going to read from the statistics also, but Senator Latimer, our future county executive, has said it all. He's the ranking member on the Education Committee in the New York State Senate, so that means he understands the needs of what children need. And it's foundational. If the child does not have a whole background, if you're not feeding the whole child, if you're not educating the whole child, we're not taking care of the whole family, then we're lost as a society.
That's right.
Children are the backbone of our society. We need to understand that if we don't raise children properly and they don't have adequate health care, adequate access to health care, which is a human right in my opinion,
That's right.
we will be lost. A future generation lost. George Latimer understands this, and that's why I'm proud to support him for county executive. But this is greater than any political party, greater than any ideological view that you may have. This is about basic human needs. A 50% cut in mental health when we have 59 people killed in Las Vegas with the shooter, and we have consistently having problems with the homeless in our society who have mental health issues, and we're going to cut that 50%. That's not something that I can live with as a state senator, and that's not something you should be able to live with as a constituent of Mount Vernon or Westchester County. So while I'm going to be really sad to lose him as a colleague in the New York State Senate because George has been striking a chord in the state Senate, I'm going to say this before I go. I'm talking about bipartisanship. If you ask anybody in the New York State Senate, regardless of their political leaning or political party, they know that George Latimer works hard for his constituents. They know that he's going to deliver for the 37th Senatorial District, and now he's going to deliver for you as your next county executive, George Latimer. I'm so happy to support George.
Right.
And we should make sure on November 7th, we get out there and do the right thing. Thank you.
Great. Thank you.
No problem, George. Anytime.
Now, Mount Vernon has had a fighter in White Plains in the county legislature, and it's a tradition that was carried on by Clinton Young, by Ernie Davis, by a lot of people. But for the last few years, Lyndon Williams, who is a respected lawyer and a respected leader, has been the county legislative voice for the majority of Mount Vernon. He has lived these budgetary battles that I've just spoken about, and I'd like Legislator Williams to please share some of his thoughts. Lyndon?
Thank you, George. The people of Mount Vernon and the communities in Westchester County who know that having health centers mean that you don't end up in the emergency rooms causing a lot more in terms of cost. These health centers provide preventative care. Here is where people without insurance or underinsured can guarantee that they're not going to fall in the streets because of a health circumstance. Westchester County has an obligation to provide health services. But just like on the national level, it has been neglected. And it's about time we stand up as residents of this county and say, you know, we're not going to tolerate that. We're not going to tolerate you abandoning in the poor and actually cutting out healthcare services in our county and in our city. So I want to ask my residents in Mount Vernon that if you do nothing else, you need to come out and vote on November 7th.
Yes.
If you really want to stop complaining, the way that you make your voices heard is going to the polls. If you don't go to the polls, these cuts will continue. Child care, cut.
Yep, that's right.
Mental health services, cut. Health centers, and I can go on and on. But we have a response and a responsibility. Our responsibility is for us to participate in the process. We did not vote, and I'm not saying us particularly, but a lot of this country did not vote. And what do we have in the White House today? We have a president that's looking to take young people who were brought here to this country and send them back someplace that they've never been. We have a president that really has determined that healthcare services are not important to people who need them, but only to people who can afford them. And that's what we're faced with here in Westchester County under the present county executive. George Latimer is a Mount Vernonite, and he actually knows what it is to really look at this county as a whole, not look at this county as just pockets of the county, but understanding that the entire county is who you represent as the county executive. And know that these children right here are important to this county as my children and your children are, and the county executive's children are. And to know that you need to provide responsible, safe daycare centers for these children and their parents to be able to have them go and participate in educational activities. So, George, I want to say this to you, that not only will you have a friend on the 8th floor in the county legislature, but I will be rooting for you all the way as we go ahead and make this change come November. Thank you.
Thank you very much. Our last speaker, and then we'll take whatever questions the press has, is Delia Farquharson. And Delia has a number of different experiences that merit us listening to her. She has a professional experience in the mental health community. She is a principal person in the My Brother's Keeper program here in Mount Vernon. She's also a candidate for the city council, but she's so much more than that. And I would like for her to share some of her comments and thoughts.
Thank you very much. Good afternoon. I'll just say that this is an argument not just about access to health services, and particularly mental health services. This is really about equity as well, right? It really has to do with, are all the residents of the county able to partake in healthcare services, and particularly mental health services? What we know in Mount Vernon, and our eyes do not deceive us, is that we have an increased number of homeless persons on our streets. When you engage those homeless persons, you find that many of them are probably diagnosed or diagnosable with mental illness. Now, cutting out 50% of the funding for mental health services is unconscionable because it places an unequal burden on this community of Mount Vernon. So I applaud Mr. Latimer, George Latimer, for bringing attention to this issue. And we cannot tolerate it as a community because Mount Vernon has borne an unequal share of the need of this county. And it must end by requiring that funding be restored and that we have services provided to the needs that exist in our community. That's crucial for all of us. Thank you.
Now, since I intend to be an executive, I'm going to use executive privilege to add another speaker to the list. Reverend Troy DeCohen, who heads the United Black Clergy in Mount Vernon, has been, Westchester, has been a moral leader, as you've heard, those of us who are secular involved in these issues. And I'd like him to at least share a few thoughts on behalf of the clergy with us.
Good afternoon, everyone. It's a privilege to stand here with all of these great men and women of leadership, not just Mount Vernon, but throughout Westchester County. It's a privilege to stand with Senator George Lattimore, our new county exec, and we are putting that in the atmosphere. One of the things very quickly, yes, I'm the president of the United Black Clergy. I'm not standing here in that capacity. I'm also the chair of the Interfaith Clergy for Social Action, in which of Westchester, in which we have our rabbis, our imams, we have our priests, our white pastors, as well as African American throughout the county of Westchester. And we have worked hard for years. Pastor Betty Thomas standing on the side of me. We have worked hard for years in the fighting to address the issues that pertain to the county. I can't tell you how many budgets with Lyndon Williams we had to partner with in order to organize coalitions in order to try to restore monies back to services. I remember last year particularly, and Legislator Williams can account to that, where Mr. Astorino was ready to cut 13 nonprofit budgets. Right. 13 nonprofit budgets throughout Westchester County, and we had to fight and organize to try to restore. And I give our thanks to Legislator Lyndon Williams, as well as to all of the legislators who fought and stood with our nonprofit industry. We had years ago we had to fight. We had here in Mount Vernon, we had a big rally because he looked to cut $1 million out of child care. We had to rally in Arsenal in order to fight, have little children with signs. Who has to have little children to come out and say, please give me child care? And we had to do this. We have always been in the fight. And I'm praying that Senator Lattimore, you will be our new exec, so we no longer fight, but we sit at the table. And thank you.
Amen. Preach.
So if there are any questions that you'd like for me to try to address, Senator Bailey, Legislator Williams, any of the council members who are here, we're happy to try to answer any questions, such as why does my phone keep going off in the middle of a press conference? Are there any questions you'd like to ask?